Welcome back to Dr. Sellers Educate. We're happy that you're back as you continue on your journey, either towards achieving CNE or renewing your CNE. Whichever path you're on, we're here to support you to be successful. We want to make sure, first and foremost, that you have your resources in front of you. First is going to be your study worksheet. Okay, so that's right here in the description. You want to print that out, write the date and the objective. So what do you want to accomplish at the end of our time together today? And then the second resource you want to have in front of you is Billings and Halstead, Teaching and Nursing, 6th edition. Okay, so these two resources are really important to help you close your knowledge gaps. If you have Dr. Sellers Educate Study Workbook, that's great also. You want to have that in front of you to help guide you on your journey. It is separated into parts, specifically with task statements and sub-competencies, so that you are able to focus on those specific areas as you move forward on your 7-week study plan, okay? And if you don't have the study workbook yet, that info is also right here in the description, how you can access that information. All right, so let's go ahead and jump into our content today. We are continuing on our journey of looking at learning theory, the who, the what, and the how. Our focus in this snapshot is social learning theory, specifically looking at Albert Bandura's work and some of the important tenets that he's described in the research that he completed. First, let's take a look at the thought-provoking question. The nurse educator is developing a variety of teaching strategies to engage students in the classroom. Social learning theory is utilized in nursing education to guide teaching learning strategies. So which learning activity would align with this theory? We have reflective journals. B is simulation activities. C is discussion forums. Or D, ticket to class. We're going to take a look at a couple of slides and then we'll answer our thought-provoking question. And hopefully you are going to choose the best answer. So what is this learning theory all about? Well, specifically, it aligns with competency content with learning theory, facilitate learning, and facilitate learner development and socialization. So how is this content relevant for our work? Well, learning happens through observation of others. That is the foundational element and the key tenets associated with Bandura's work. Learners who believe they are competent will have a strong sense of self-efficacy where they're confident in their learning, they're confident in their learning that has happened, and they can handle more complex patient care. We think about our students in a clinical setting, and we know we can see it for ourselves. Even if we may not have fully understood Bandura's social learning theory, we've seen these students, the ones that feel like they can help their other students because they have finished all of the work and prioritized the care that their specific patients need, or they just ask for more. They want to take care of a more complex patient, and they are ready to move forward on their learning trajectory. There are 3 key responsibilities we have in the nursing education program to make sure students are achieving the learning objectives that we have set out for them. First, as clinical faculty, we are going to be the ones who introduce students to the clinical setting, right? Second of all, the didactic faculty, we're going to make sure in collaboration with the clinical faculty that there is alignment between what we're discussing in the didactic setting and what students are able to apply in the clinical setting. And of course, we're going to include our lab faculty and our sim faculty as well. And then third, we want to take advantage of the pre-conference and the post-conference, right, to give students time to kind of process some of the information that they are planning for as it relates to that clinical experience, or that they have actually seen as part of that clinical experience. Self-efficacy is going to reflect confidence in the learner's ability to exert control over the motivation, their behavior, and the social environment. Okay, so those are some of the key tenets you want to consider when you are reviewing content related to social learning theory. We were excited to receive notification that our abstract was accepted to be presented at the Association of Black Nursing Faculty 36th Annual Meeting and Scientific Conference on June 7th through the 10th in 2023 in Biloxi, Mississippi. So if you're watching this episode in 2023, we're excited and hopefully we'll meet some of you there. We will be focused on the role of the nurse educator certification and the 5 key steps to reigniting nurse educators with resilience and passion. We know that The pandemic and other competing challenges have definitely affected the nursing education space as well as the healthcare setting overall. If you chose B, simulation activities, you are correct. Some examples of teaching strategies that align with social learning theory are going to include role playing, simulation, clinical learning experience. All of these teaching strategies are going to help students develop the self-efficacy that's so important. This specific concept of self-efficacy really does provide a foundation and provides a pathway towards competency and clinical judgment and advancement of nursing knowledge and application. Okay, so that's what this is all about when we think about equipping our students in a way that they're able to provide the best patient care possible. Okay, they've got to have the competence, and we want them to have the confidence as well. The resources that are going to best support your review of this content is going to be Billings and Halstead, page 254. That's where you're going to see at the very top the implications for nursing education, the description of these teaching strategies that we've talked about, as well as table 14.1, page 250 of Billings and Halstead. That's where you're going to see information on that table about specific tenets or underpinnings associated with social learning theory. And then Appendix A is always a great resource to review, page 161, 5 common learning theories that you want to make sure you're knowledgeable about as you move forward on your journey towards CNE or towards renewing your certification. You can always reach out to us, info@drssellerseducate.com. We do have a list of all of the programs that we offer on our website, drssellerseducate.com. We hope this has been helpful. And until next time, we hope you have a great one. Thanks, everybody. Bye-bye.